Also, we're going to go live on YouTube just briefly for about 5 or 10 minutes. So you might see something on your screen talking about that. Last thing, remember, if you can't speak, that's fine. But tell me in the chat box now, guys. It's really important that you let us know. Also, we're going to go live on that you let us know. So I'm not waiting around, basically. Okay. So talking. Let's get started with this. Can everyone see my screen? Does everyone see this here?
Yes.
Yes. We're going to do a test.
I can see.
You'll do a test later with Dr. Allen, okay? And I'll be trying to just show you some of the things that will happen to you in the test. It's not going to be like a real test, but it's more like me showing you what things you need to look out for. So in this class, guys, introduction, as I said before, techniques, and then a little bit of practice, okay? So in terms of introduction, maybe we could start maybe with Shrad. Do you want to say hello, Shrad? You said you're just starting with OET. Could you put your microphone on?
Yes,
No?
hello.
Okay, fantastic. So we're talking about listening part C. So this is a sort of test for you. Do you know how many questions there are? Sorry, listening part A, not C.
Part A.
Yeah. How many questions are there?
I'm not much aware, but it is like what do we say?
Well, this is why we do this. So
10,
can anyone help?
10 to 15 questions?
Almost. Can anyone help, guys? How many?
24.
24. Okay. So
Longer.
microphones off, please. These are some basic things, guys. There's 24 questions. And what's a good score? Victoria, Ukor. Ukor, you're a pharmacist, right?
Yes.
It's the same test for doctors, as nurses, as everyone. So what do you need to score, Ukor? Probably.
18.
Go on.
18.
18 from 24.
Yes.
No, it's 22 maybe.
Well, it's not very ambitious, Ukor. You can do better than that. I'm not saying that in a bad way. I'm saying that part A it is possible to get 20. You can definitely get 20.
No.
Zuhal, microphone, please. Guys, we're keeping microphones off unless I say your name. That's the idea. So 18 from 24, Ukor. Let's say, could you come back, Ukor? What if I said I want 22? Do you think I'm being crazy?
That's very high.
But the thing is, guys, if you know the test, you know that part C is really, really quite easy. Okay, and you've got to, I think, try to push yourself in part A so that you can just kind of relax in part C. Okay, 22 out of 24 is not impossible. It's very doable. Okay, let's talk about more details of this though. So, Jonah, are you there? We've got Gloria. We want 22 from 24. Jonah, tell me something. You know the exam well. Tell me some important things about the exam.
Well, part E, listening part E, as we said, has 24 questions, but are 2 audios. 12 questions are in each audio.
It's 2 audios, excellent. And there's 12 questions each, yeah? Okay.
And we have a gap filler type of questions.
Okay, gap fill. They are. Is that right, everyone? There's a sort of gap fill style, everyone?
Sort of, yeah.
Yes.
We have lots of different phrases. You can say gap fill. You can say fill in the
Gaps.
Fill in the gaps or the blanks. Sometimes we say
Blank.
it's the same thing. So you'll see an example later. So, Jonah, how long is each audio? Because not everyone knows that.
Approximately 5 minutes. Sometimes it's 4 minutes. Sometimes could be 6 or 7 minutes, but approximately, like in average 5 minutes.
Okay, and Elif, Gaye, what are we going to listen to? Will it be one person speaking, 2 people speaking?
2 people. Consultation.
Consultation. Is it always a consultation, everyone? Is it always a consultation?
Yes.
So, if you want to practice part A, you can't just do OET classes, SCT classes. You need to do some personal study. go and find examples of consultations. Now, I'm going to recommend one. It's not what you think, if you've seen my classes before. Does anyone know the Nottingham University consultations? Has anyone seen those before?
Yes, you mentioned before.
Yes, we did. Yeah, I did.
Yes.
So
No.
They're really good. I'm going to put them in the chat. Okay, I'm going to put them in the chat for all of you. If I can find it. 1 second, Nottingham. I can't share my screen. But this is all of you. What I recommend is listen to these a lot. Okay, don't just listen one time and think, oh, I listened to what Alan gave me, finish now. Go and listen to each one 10 times. Go and listen every day. Okay, they're very good practice audios in the chat for you guys. Okay, obviously you can't do mock tests all the time. You have to go and listen to things, and if you're not understanding something, right, if you hear something strange, an accent or some vocabulary, stop, go and investigate what you're listening to. Okay, so we're listening to a consultation. It can be between a patient and a GP, or what? Does anyone know?
Patient specialist.
Yeah, patient GP, or sometimes it's specialist. Zuhal, does it make any difference really? Or
No.
not really, I guess. You can see at the start though, guys, when you read the test, it will tell you the situation. You're listening to a dialogue between two people. Omi, who's going to do the most amount of talking, the doctor or the patient? Omi.
Patient.
Patient, like a lot more, right? Guys, patient will do 90% of speaking, maybe. Patient will do 90% of speaking. But Omi, what does the doctor do? Usually the doctor is doing something. Do you know what I mean?
Just asking question regarding patient symptoms or problems.
Doctor is asking questions.
Yeah, and giving some advice or recommendation regarding lab test.
What do
Or
those questions tell us, though? Have you noticed that the questions are always something?
They are signposts for us.
Do you agree with that, Omi? She's saying they're signposts.
yes.
Guys, they're almost always, let's say 95% of the time, they will be signposts. So the doctor sort of changes topic. Does that make sense? When the doctor speaks, you might move to talk about symptoms, or the doctor will ask a question, they will talk about treatment or equipment. The doctor changes the topic, and you can use that. We'll talk about this later, okay? What sort of listening are we supposed to be being tested on? Aisha, Grace, is it listening for the main idea? No. So what kind of listening are we doing here? Do you know? Hatis?
No, I don't know.
Listening for details.
Hatis, it's listening for details. Okay?
Yes.
Listening for details. Oh. And are you very good at this type, Hatis? You find it easier than other ones?
Yes, it is easier for us because it might be for our subject. I have no idea.
Well, I think guys, it must be easier than listening for a main idea or listening for inference, other types of listening. Does everyone agree with me? This has to be the easiest type.
yes, because it's straightforward. You know, if you listen. You don't need to think what they say.
Exactly. You don't really need to understand that well, do you? You just need to get the word, get that word that they said, write it down. Okay. So I like that. This is straightforward listening. Okay. You're focused on something. So I want to talk about techniques that you can use when you're listening for details. There are 3 that I always like to focus on, but let me just ask a question to Fumi. How much time, Fumi, do we
Yes.
have?
Hello.
How much time before the audio starts?
I think 90 seconds.
Is that right, guys? Is it 90? I'm not
No.
sure about that. How much time before the audio starts?
30
30
seconds.
30 seconds before audio.
Unfortunately.
So one of the key techniques that we normally talk about inside this 30 seconds is going to be what I call categorical listening. Okay, categories. And we know we're listening for details. Okay, so think about it. If you're listening for a specific thing, just think about this. Do I need to know what that thing is?
Yeah.
So, like if I tell you guys, okay, everyone, listen for details. Ready? There's 3 things. 1, 2, 3. Listen now. Yesterday I went to the shops and I bought some bread and some fish, and also I got some minced pork, and also I got some yogurt, and then I walked home and I saw a shop that was selling TVs. Suleiman, Yalda, what are the 3 important things that I just said? What's the answers? I always try to make this point, okay? If you don't really know what you're listening for, it's just pointless test. But in OET, we do know exactly what we're listening for. This is an example here. Yaya, patience. Ertan. In this example, what am I listening for? What am I listening for here?
You're listening for a detail here.
What type of detail? Blank revealed. Anyone?
Test.
Maybe test. Yeah.
Investigation.
Investigations, right? So that's it. You've got 30 seconds. And in the 30 seconds, you, not all of them, but many students try to think about what type of thing am I listening for? If you're listening for details, of course, this is very, very useful. Yeah, do you want to ask me a question? Go on.
Yes, sir. Honestly, this kind of question is very difficult for me always. When it's start with a blank straight away, it's a kind of difficult question for me in exam. Yeah. So what would be your advice, sir?
So the first thing would be categories. Do you know what the categories, the usual OET categories are?
Yeah.
Go on.
We are listening for like these symptoms.
Symptoms. What else?
Yeah. Tests.
Okay, so stop there. Microphone's off, please. Yeah, you've got a bit of noise. Guys, is he right with symptoms? Everyone?
Yes.
Yes. Tests. Can anyone else tell me more? Conditions?
Occupation.
Occupation. What else? Everyone. Occupation.
Treatment. Medication.
Equipment,
Description.
and description.
Injury.
I want to test some of the new, let me test some of the newer people because I know a lot of you know this. But let's go for Shrad. Shrad, could you say hello? I muted her, so she's just trying to get the button.
Yes, sir.
So do you get the point? We're listening for specific types of things, and this makes it easier, right? So there's about 14, 15 OET categories that we always see. It's always the same ones. Can you tell me an example? Symptoms, test, conditions, occupation, equipment.
Okay.
Shrad, do you think that maybe treatment would be one? What do you think?
Treatment.
Do you think that's a category in OET?
Yeah, type of treatment.
Exactly. So this is a category. Jonah, give me another one. Florina, just so we can do this fairly quickly. What have we got? Treatment.
Could be the tricky part is the description of something. This
I'll
is
do
the
that one at
tricky
the
part.
end. I agree. Give me
Okay.
another one. Give me another one.
Diet, test,
Diet. Okay.
people.
This is a good one. Angela, can you tell me one? Ayodola, there's about 14.
Hobbies.
Hobbies is a very common one. Misha, give me one. Hatis, Hadi. Let's do this quickly.
Body part.
Body part. Action as well, right? You just reminded me. Action. Anything else, guys?
Job and time.
Time.
Job, hobby,
We have
time.
occupation, definitely time. Doigu?
Medication.
Medication, thank you. That's a very clear one, isn't it? Guys, sometimes you get injury at the same time. Injury, definitely one. Any more?
Senses.
Senses, yes, and feelings, right? But the last one, the most important one, the one that you will see very often, everyone, is what I will call, description of. So Zuhal, you said this. What is description of? What is that?
Description is, for example, we have a symptoms there, but we need an adjective for that to describe how that was, or we have a verb there and we need a description for that.
It's a good one. Guys, does that make sense? What she's saying to me is very clear. So
Yes, makes sense.
you might say tests, right? Tests revealed, right? It's the adjective that's not there. Okay. It's not always an adjective though. Guys, it could be, look, what if it says blank, test revealed blank diabetes? Am I listening for an adjective?
No.
It could be
a
noun.
description, description of something else that in this case is diabetes. We describe the type of diabetes.
Like compound nouns, isn't it, Dechoda? Compound nouns, you're going to use two nouns sometimes. So you're listening for the first one. Okay, so we'll practice this in a minute. If this is a new idea to you, then you can practice today. But we can't do, how many questions are there, everyone? How many questions?
12.
12.
12 and 12.
So Gaye, I can't do 12 in 30 seconds. Do you agree?
Yes, I can
How
do
many?
six maybe.
6 would be good, guys. Try for 5 or 6. Sometimes it's just really easy. You can do it really fast. Okay. But the key point is the category tells me what I'm listening for. It gives me a direction. Okay. So it actually, I've been doing this a long time and it's never a bad thing to do this. It's always very, very useful. In every test I've ever seen, this is helping. Okay. Another technique though, Ertan, do you know any other techniques that we could use here, Oscar? One would be categories, simple categories. What would be another technique?
Signposts.
Signpost. So tell us, what is that? Signpost. It's very easy, but can you tell us? What is a signpost?
Choose some where I am.
So some words tell me
where I am.
Where I am. So where's the signpost here, Ertan, in this example?
Before a blank sentence. Yeah, headache and dizziness.
Okay, so guys, it's a very, very obvious thing, but you can just notice where your signposts are because it helps you to not get lost. Simple. All right, so there's also a very simple rule. Nakwimba, nice to see you. What's the rule that I always mention every 2 weeks? Do you remember my rule?
We should check the words around the blank.
What's around the blank? You think can this be a signpost?
No, signpost signposting can be some words like now we will discuss about maybe the investigations. Maybe it can tell us
Maybe I get that, but I'm keen on just to be clear. Can any words in this line be a signpost?
No.
No.
Needs to be on a different line from the answer.
Always on a different line. So, because of course, what do you think OET are going to do with this line? They're going to
they always paraphrase.
Right? So that's why if they did not paraphrase, it would be the easiest test you can imagine, right? But of course, what they will do is they'll change this. They won't say revealed high blood pressure. They'll say it in a different way. So Neslihan, can you give me an example of a way to paraphrase this? Suha, how can you?
Which one? Dizziness. Dizziness.
This one here, not the signpost. This one.
Revealed high blood pressure.
What's another word for revealed?
Showed.
Showed, right?
Indicated. I don't know.
So they can say showed. What else might they say, guys?
And also they can
The
paraphrase
reading
high blood
shows
pressure.
increase.
Let me just get Theodora. How do I say high blood pressure in a different way?
Hypertension, maybe. So they will
Hyper, yeah.
paraphrase also that one.
Okay, and then will the answer come here and then here will be the words? No, not always. Guys, it might be like this. Hypertension, we can use the passive, right? Was shown by a number of different things, including, and then the answer comes here. You get the point? Don't take any of these words as something that will show you where you are if you want to get this answer. All right? You have to look for words with no gaps. Signposts have no gaps, no blanks. Just quickly note that it'll take you 1 or 2 seconds just to quickly see, oh yeah, here's my signposts. Okay? Don't get lost in the exam. If you get lost in the exam, it's a bit of a disaster. If you don't know where you are, it could be a really bad score for you. Okay, so we are looking for categories. We're looking for signposts as well. There is a third type. Oscar, Svetlana, could you tell me the third type of thing that we can look at? Svetlana, sometimes you're able to speak these days.
Yeah, I can't speak.
Okay, 1 second. If you're watching on YouTube,